you are attempting for a meniscus healing. Usually meniscus, they reaches 80% of their tensile strength by 12 weeks. If it is a vascular zone tear, the complete healing usually happens in 10 weeks. Better healing you can expect if it is a concomitant ACL repair or ACL reconstruction, or if a tear is close to the peripheral rim. However, the poor healing can happen if it is a ACL deficient knee or an unstable knee, or if the tear is in a avascular zone. For the rehabilitation protocol, we usually we keep the knee flexion 0 to 90 degree for 6 weeks, and deep squats we allow only after 12 weeks. Touch toe weight bearing is allowed immediately in case of simple tears. However, if it is a bucket handle tear, we usually keep the patient non-weight bearing for 4 to 6 weeks. Pivoting sports are allowed only after 12 weeks. Success of a meniscus repair is based on how well you debride the tear, how well you are going to cause the apposition or the anatomical apposition of the tear. If you are attempting the concomitant ACL reconstruction, if you are doing a capsular indentation to increase the vascular supply at the site of tear, or if you are following a proper post-op rehabilitation. Whenever the tear is vertical or a longitudinal in a vascular zone in a young patient with a stable knee, always repair and preserve the meniscus, because if you preserve the meniscus, you can prevent the early onset of arthritis. However, if it is a complex tear in a poor healing zone like a white zone, maybe it is advisable to do a partial meniscectomy. To conclude, meniscus repair in a stable knee, it gives better results than those in an unstable knee, and when combined with the ACL reconstruction, the tears heal best. So to summarize, a well done meniscus repair prevents the early onset of osteoarthritis, and you should always try to preserve and repair the meniscus whenever it is possible. Thank you. Thanks a lot.